Let me ask you something. Do you know your blood pressure? Because nearly half of American adults have high blood pressure, and 1 in 5 don't even know it. That's millions of people carrying a ticking time bomb in their arteries. We call it the silent killer for a reason. No symptoms, no warning signs. But it can strike with a heart attack, a stroke, kidney failure, just like that. The scariest part? Even among those who do know they have high blood pressure, only 1 in 4 have it under control. But here's the good news. It doesn't have to be that way. You can take control. And many people can lower their blood pressure naturally without needing medications. And today, we're going to show you exactly how to take back control. In this video, we'll count down the top 7 proven ways to lower your blood pressure naturally, without medication. Backed by science, easy to follow, and powerful enough to make a real difference. I'm Dr. T, board certified in cardiology and lifestyle medicine. I've helped thousands of patients over 50 take control of their blood pressure using these very tools. Let's dive in, starting with #7. Even modest weight loss can dramatically lower your blood pressure. Being overweight or obese raises your risk of high blood pressure. Losing even 10 pounds can lower your blood pressure. And weight loss has the biggest effect for those who are overweight or already have hypertension. In general, blood pressure might go down by about 1 millimeter of mercury for each kilogram. That's roughly 2.2 pounds of weight loss. We also check BMI and waist circumference. Waist over 35 inches in women, 40 inches in men is considered high risk. There's no magic formula. You must eat fewer calories than you use. 1 pound equals 3,500 calories. So to lose 1 pound a week, aim for a 500-calorie deficit daily through eating less and moving more. Why? Extra weight makes your heart work harder, and visceral fat around organs is especially dangerous. The good news? You don't need to starve yourself. Small, realistic changes add up. Try these small, realistic changes. Skip sugary drinks and go for water or herbal tea. Eat from smaller plates to reduce portions, and focus on fiber-rich foods to feel full. People who lose weight often see better sleep, more energy, and less joint pain, all of which help blood pressure. Small wins matter. Next, #6, follow the DASH diet and eat smart. DASH stands for Dietary Approaches to Stop Hypertension. It emphasizes fruits, vegetables, whole grains, lean proteins, low-fat dairy, and less red meat and sweets. It's the overall pattern that matters. Here are 10 foods to include that support normal blood pressure. 1. Unsweetened yogurt, rich in calcium, potassium, and magnesium. 1. Berries. Strawberries and blueberries contain anthocyanins linked to lower blood pressure. 1. Beets. High in nitrates that help relax blood vessels. 1. Sweet potatoes. Packed with potassium, magnesium, and fiber. 1. Leafy greens, high in nitrates and potassium. 1. Fatty fish like salmon. Omega-3s and vitamin D support heart health. 1. Whole grains, especially oats. Beta-glucans may lower both systolic and diastolic pressure. 1. Pistachios. Unsalted nuts can lower pressure during stress. 1. Bananas, a powerful potassium source. 1. Kiwi fruit. Studies show 3 a day can help lower blood pressure. A simple place to start. Add just 1 vegetable to every meal this week. Small dietary wins add up. Poor sleep raises your risk of high blood pressure. Aim for at least 7 hours of good quality sleep each night for repair and hormonal balance. Chronic sleep deprivation activates stress hormones like cortisol, which can raise blood pressure. If you snore loudly or wake tired, talk to your doctor about sleep apnea. Tips for better sleep. Stick to a consistent bedtime. Avoid screens 1 hour before bed. Keep your room dark and cool. Limit caffeine after 2 p.m. Try magnesium-rich foods like almonds or bananas to help relaxation. Small changes to sleep routines can lower your blood pressure over time. Better sleep supports better blood pressure, mood, and energy, all important for long-term health. Next, #4, manage stress effectively. Coming up, practical stress tools that really work. Let's be honest, life is stressful. Chronic stress acts like a slow drip of adrenaline and cortisol in your bloodstream, keeping blood vessels tight and blood pressure high. Short spikes happen with stress. Over time, unhealthy reactions can damage arteries and raise long-term risk. Start today. Simplify your schedule. Delegate, say no, and prioritize what matters. Breathe deeply. A few slow, deliberate breaths calm your nervous system instantly. Move your body. Regular exercise is nature's stress reliever. Check with your doctor if you have high blood pressure. Try yoga or meditation. Even 10 minutes can help. Bonus tips. Take 1-minute breathing breaks. Keep a gratitude journal. Spend time in nature. Set boundaries with draining media. Use guided apps like Calm or Insight Timer for short sessions. Stress management literally helps your blood vessels relax. Next, #3. How alcohol affects blood pressure and easy swaps to reduce intake. If you drink to relax, think again. Alcohol can raise your blood pressure, especially above recommended limits. Drinking too much also harms the liver, brain, and heart. If you drink, do so in moderation. 1 drink a day for women, 2 for men. 1 drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of spirits. Keep portions small. Try smaller glasses, alternate alcoholic drinks with sparkling water, or try non-alcoholic beers or wines. Even moderate alcohol can interfere with medications, sleep, and weight, all important for blood pressure control. Small habit changes around alcohol can have a big effect on your pressure and your overall health. Next up, #2. Quit smoking for good. Quitting smoking is one of the most powerful steps you can take. If you smoke, quitting is the single most powerful thing you can do for your blood pressure and your heart. Every cigarette causes a temporary spike in blood pressure, damages artery walls, and reduces oxygen, making the heart work harder. Here's the hopeful part. Within 20 minutes of quitting, your blood pressure starts to drop. Within weeks, circulation and lung function improve. Talk to your doctor about nicotine replacement, medications, or support programs. You don't have to do it alone. Many tools exist: patches, gum, meds, and community programs that greatly increase your chance of success. Quitting smoking improves blood pressure, lowers heart disease risk, and adds years of healthier living. Next, #1. Practice deep breathing or meditation. One of the fastest, most accessible ways to lower blood pressure naturally. You don't need a gym or equipment. Slow, deep breathing is defined as fewer than 10 breaths per minute with long exhalations. Slow breathing lowers sympathetic tone and raises parasympathetic tone, promoting relaxation, endorphin release, and lower adrenaline. Try this now. Breathe in through your nose for a count of 4. Hold for 4 seconds. Breathe out slowly through your mouth for 6 to 8 seconds. Repeat for 2 to 5 minutes. Daily practice lowers stress hormones, relaxes arteries, and improves heart rate variability. Even 5 minutes a day helps. You can also try guided meditation apps, mindful walking, or progressive muscle relaxation. Studies show slow breathing for just minutes can lower systolic and diastolic pressure significantly in people with hypertension. Bonus tip coming next: the heart benefits of pet ownership. Believe it or not, owning a pet, especially a dog, can help lower blood pressure. Pets encourage activity, reduce stress and loneliness, and release oxytocin when you pet them, all supportive of heart health. If a pet fits your lifestyle, it can be a joyful, heart-healthy companion. Pick just one of these steps to focus on this week. Nearly 1 in 2 US adults has high blood pressure and 1 in 5 don't know it. But you are not powerless. These 7 steps and the bonus tip are within your hands. Pick just one to focus on this week, then build from there. For more, watch our next video. Top 7 drinks to lower blood pressure naturally, and check links in the description. If you found this helpful, hit like, share this with someone you care about, and subscribe for more heart-smart tips. I'm Dr. T. See you in the next video.